Welcome to the CAP demonstration of the patient experience survey that we have provided, and we are very excited about this. We have the most up-to-date and simplest to use platform there is. It's the Physician Empowerment Suite, and we do have some other products. So at this point, I'm just going to tell you that every physician along the continuum is going to absolutely need their own data. SE is a group of physicians and nationally and internationally renowned people, and wanted to let you know that this is not a bunch of us in a garage that created this. This is actually tops in the field that saw a drastic need and a gap in patient satisfaction. So at this point, we actually have clients all over the country, and our big deal is, the fact is, every single physician is going to have to measure, because they're being measured now, but we're providing you with metrics to improve, and then from there, leverage it to profit. Physicians need their own data. The healthcare system is creating narrow networks. You, as physicians and physician groups, are up against a lot of different issues. We know that. The fact is, you are being measured, and unfortunately, a lot of the data you're being measured with is not valid or very, very questionable data. We know for a fact that a lot of the payers are using data that is 30% correct at best. Benefits for you and your group: enhanced economics, obviously increased referrals. The better you are, the more likely you are to get your business and your patients to send you new people. Reduced bad debt. This is a new element, unfortunately, in your business. Up to the past few years, bad debt really wasn't an issue, less than 1%. With the higher deductible payments right now, and more importantly, more people and less income, what is happening is, if they are unsatisfied with you or your practice, they are much likely to not pay versus pay. The more satisfied, there is a direct correlation between satisfied patients and them paying their bills. We're seeing bad debt ratios go up 3 to 5% right now, and that is a big piece of your business if you can recover or avoid. Enhanced fee-for-service payments. You need your own data to go prove your point, and we have helped many physicians and practices negotiate leveraging our data. And the fact is, without your data, you are now, unfortunately, at the behest of their data, and again, it is not good data. Ultimate goal, let's face it, we're trying to improve patient outcomes. We're also trying to lower risk claims. All of you are independent, or at least probably most of you are, and you have a desire to stay independent if possible. Physician burnout is a real issue right now, and we recognize it, and some other pieces of our Empowerment Suite address this, but unfortunately right now, everyone is operating under extreme stress, lower revenues, less time, and the patient feels it. And after all, they are your client, and you want to try and get the best possible outcome for them, which then does help you in the end, but that's not your goal. Your goal really is to make sure you're giving the best care possible. Private payers are all going to value-based, and basically patient satisfaction is one of the key elements to this. If you're not measuring it, you will not be in the game. Cost, quality, and satisfaction are 3 elements. Cost, we can't really do too much about. Quality, you can try and address. Patient satisfaction is the easiest, cheapest, and most flexible, and we are providing that at a very, very high-end quality, response rate, etc., at a very low price, of which your carrier, CAP, has found us and bargained. You are about to have the ability to get your own data very fast and leverage it with your payers. Physician concerns. We know this: penalized for factors out of your control, inadequate performance measurements right now, defining quality. You're getting unreasonable performance goals, etc. I'm not going to spend a lot of time here. A lot of administrative work suddenly is being put on top of all of you: declining revenues, work volume, stress, burnout. So what we're doing is we're trying to provide you and arm you. We have a patient experience platform. We do have specialty-specific surveys, and now we are developing a whole new version as well. So we will have approximately 22 different specialties, Everything is online, dashboard reporting, quality metrics. We are only asking questions that you can actually do something with, not generic questions, specific questions, and you'll see those. Explaining things well, listening carefully, spending enough time, etc. We compare locations, physicians, and benchmarks, and you'll see that when we show the demo. We compare against national and anyone on our platform. We also compare against the CG caps, if you've heard of that. We compare against those metrics. We have 2 open text fields for written comments. The text fields, we have one after the physician questions and then one after the practice operations questions. This provides an awful lot of insight to the issues or the great things that are going on. One of the real benefits here, and it's going to sound odd, is the fact that physicians actually get to see something nice about themselves. This is not typical when people interact with physicians or you. Typically it's an issue, it's a complaint, it's something isn't done right. Not often do you or the physicians hear, hey, Dr. Lou is the greatest doctor ever. They get to read this, and worst case, they get great self-worth out of this, because it is not an easy industry right now. But then on the flip side, you also do get those things that each physician or person can possibly do better, or the phone systems are not good, etc. I'll show you a couple here. The survey is sent out electronically. It only takes less than 5 minutes to complete, because we have created a mobile technology to make it very simple for the patients, easy to implement and use. Basically, from your perspective, it's going to take you 2 minutes a week. We ask you out of your EMR to initially create a single file with approximately 12 data fields. Once you create that file once, then you just run it once a week and upload it to us. It is very simple, and that is all the time you need to take. And cost effective, I think you all know, we have negotiated, and it's $28 a month per provider. This is a snapshot of some of the dashboards. You'll see those momentarily. How does it work? In the gray on the left is basically all you have to do. Log into the EMR system and then log in to your dashboard. As soon as Mrs. Smith takes the survey tonight, tomorrow the dashboard will be updated in aggregate. We do everything on the right, and we're cleansing the data. We are sending the reminders. One of the things that people are concerned about is getting over-surveyed. We have a checkpoint in place that if a person has received a survey in 90 days, within the past 90 days, they will not receive another one. So we're trying to avoid survey fatigue as well as survey bias. We don't want the same people answering the surveys all the time. This is really great. And what I didn't point out on the other slide was, by the way, our survey response rates are between 25 and 40%, which is huge. It's a huge number. So instead of getting 5 surveys back, we're talking about getting 30 back a month. This is really incredible, because the people want a relationship with their physician. That's why they're more likely to answer these in a Best Buy or something like that. You'll note here on the survey invitation, it will be your logo going out, so it's actually coming from you and your practice. The survey looks similar to this. This is just one of the questions. Please rate how well. And as soon as you click on the very good, excellent, etc., it automatically scrolls, which then leads the people to continue. Easy EMR interface. We have yet to run into an EMR that cannot generate these 12 data fields in a report. It is very, very simple. Use it as an early warning system. Whose scores dropped last month, why, etc. We can home in on it. The physicians use it, and within a half an hour, once a month, they know exactly where the locations compare to each other, where the physicians are, trends, etc. Some free text feedback. These are just some samples. The middle one, unfortunately, is these are all real. Your telephone answering system is awful. And then, moreover, found a staff who answers the telephone consistently unpleasant. Well, you know, you don't want to necessarily read this, but you do want the feedback to understand what you can do to improve, because without this, you would not know. We know also from a liability perspective, the more satisfied the patients are, the risk of claims goes down. There's a direct correlation. Testimonials, we have 100% retention rate. Our deal is very simple, which is $28 a month per provider, unlimited surveys, no setup fees, no contract period. If you don't like it, you let us know. We do need 30 days notice to turn off the surveys, but we have not had anyone cancel yet, because once they start getting this data, they realize how valuable it is. It is truly the future, and you need to have your own data. Given that, I am going to go log on to our dashboard. So this is your initial log-on screen. This is showing overall provider satisfaction rating. And I'm going to scroll over. So here in January, if you look at the small number next to practice average, you see 354N. That's how many. This is a 12-doc urology practice. So you can see that we are getting a huge number of N's. So this is comparing the national average. We can change the benchmark to the CG CAPS average. You'll notice that we have a group here that is outperforming and certainly well above average in the overall provider satisfaction rating. So what we have is, when you go look at would they recommend the practice, suddenly we're in a situation where they're below average. And unfortunately, you can see in January, they've ticked back down. They keep trying to work it up. So here's the question: why are they below average when their physicians are great? This is really critical. So people like the physicians, but the practice they're having issues on. So we're driving down into the practice ops, and that's just showing their practice average. But when you go against the national average, well, their phone system is one of their issues. And you will see here that they've tried to improve, but they have one of those phone systems that you cannot get to a human being. And there are some solutions to that, but they have decided not to spend the money, and now they are having lower satisfaction ratings. So worst case, you can identify it, what the issues are, being informed about delays. This is one of the more critical and highly correlated pieces of information that the clients need. If you inform them about the delays, they're much more satisfied. If you just let them sit there and not, it's an issue. So this practice has been working on that, and you'll see they're really making a point of addressing this. So again, we can drive down on any of these. I'm going to show you something interesting. So I'm just going to go to December. We can start looking at the physicians side by side. Actually, I want to go up to overall provider satisfaction rating. Over here, and I'm going to do it against the practice themselves, we have a couple doctors that really are underperforming. And you would really want to know what is going on over here with these two people. And you can start driving down on the different items, but we can just start immediately go to the report card. You get these report cards once a month for each doctor. And here's Abraham Lincoln. You'll notice that he is performing now. In January, he has really started to outperform the average. He's constantly increasing. He is focusing on his issues. And that's important because the whole practice and revenue stream will depend on him. We can also compare locations, and we'll see that the Bunker Hill office is underperforming. And again, we can start driving down by item, where they're underperforming, who's performing well in different areas. Ease of appointment scheduling is obviously an issue for this practice. We can also go to the individual specialty, in this particular case, specialty questions, we have data on as well. But the core questions are those that you are going to stay focused on. What we are providing you is power. And truly, we're trying to empower you and empower the physicians to get better, to help the patients, and more importantly, let's make healthcare better for everyone. I thank you all very, very much for attending, and please send me an email. We will get back to you immediately, and you will be joining many, many thousands of doctors on this as well, and understanding how to leverage this for your betterment.